So what I have today is just kind of 4 steps, pretty high level, not super technical, around how you might get started with measuring progress and outcomes of whatever particular program and or intervention you might have in mind. We're gonna then have a bit of a breakout discussion and maybe focus around how, I hope this is relevant to everyone, but how different ways you can involve program or service recipients, clients, whatever the right word is for your initiative, in data and measurement, and either deciding what to measure, measuring it, and interpreting it, and then reconvene at the end to sort of share some advice and other questions that might still be lingering. And my hope is today that everyone, I've got a bunch of resources sprinkled through the slides, some tools that I've used or that I've seen other people use. Hopefully some of those will be useful. I can't imagine all of them will be useful to everyone, but hopefully there's enough in here that y'all can walk away, even if it's just with a good idea from a, you know, that you've heard before but didn't hear in that particular way or something, so that everyone leaves with some tools to help you think through wherever you are in terms of measurement and outcomes. All right, next slide. And just to sort of be explicit, things I'm not going to talk about right now are like what specific software should you use to track, I don't know, your return on investment or something, or like how to negotiate a better deal with your data systems vendor, or any, you know, analytic methods, data governance, data sharing agreements. Those are all things that a lot of this stuff tends to touch at some point or another, but are not really, there's only so much we can do in one day, and I wasn't going to focus on those today, but we can also, you know, if we keep a running list of questions we're not able to answer, we can do some follow-up. Next slide. Okay, so really, really high level 4 steps that I'm going to talk about. None of, you know, only 1/3 of which really gets into measurement per se. But I find these things are super helpful for just starting thinking in a rational way about measurement and tracking progress. So the first is around being clear about your program goals and kind of the theory of change, or how you think your activities are going to get towards those goals. Secondly, being clear about audiences and use cases for measurement or for tracking your progress or outcomes, because that can really help you prioritize what you pay attention to. I want to talk through a couple ways in step 3 to kind of pick or build a set of measurements or indicators, and then some tips on how to get started with tracking if that's a boat you're in. Many people, I'm sure, are already tracking a bunch of stuff. So this probably, step 1 probably sounds fairly obvious, but it is really kind of hard to figure out, or it's easy to get into the lost in the weeds of measurement possibilities if you're not starting from a kind of clear idea of, okay, we're running at this particular initiative, or we're trying to expand our reach under a program that we've been running for a while. What should we pay attention to? And if you lay that out in a way, you know, what are we doing? What might that lead to? Why are we doing that? You lay that in a way that can really help you figure out what measures are most appropriate for seeing whether that logic is carrying through. So this is kind of, you know, if we do X, then Y because such and such sort of thinking, or, you know, do X so that Y happens. Next slide. And even though this can seem elementary in some ways, or like, oh, everyone knows this, we're all clear on what this program does kind of thing, it can be helpful just as an exercise to get everyone in the room or virtual room, or have everyone look at the same piece of paper to clarify that everyone's on the same page. I've done a lot of kind of logic modeling kind of exercises, and you know, you get people drawing things, and then all of a sudden it brings up oh wait, I thought, you know, I thought this set of folks, you know, our primary goal was to have them, you know, build such and such a skill, not to, you know, refer them to this other agency. So getting the stuff on paper can help just make sure how everyone's on the same page about how your program or initiative works, and particularly what it's needed to make sure it reaches its goals. And can help build a shared language among folks. It's a way also, or can be a way to engage your participants and stakeholders in both in program design and feedback, and can be a way to kind of, especially if you end up with a short either narrative or visual description of what you're up to and what you hope it will lead to, that can also just be a way to help engender broader support, financial or otherwise. So there are a lot of options for kind of laying out your program goals and logic. Is this, I mean, before I go on, is this the kind of thing that folks y'all have done? Like is logic models or theories of change or driver diagrams, that kind of thing, or, short narrative summaries? Can folks do a show of hands about whether this is something you're familiar with? Yeah, well, of course I can't see everyone. I'm seeing a hand. It could be a virtual hand too. A couple there, okay. Okay, well, I just have a couple examples of different kinds of these sort of models that I won't beat to death or anything, but just as examples to sort of show what options there are that I'm familiar with anyway. So if you can jump to the next slide, thanks, Demetria. So one, especially that gets used a lot in public health kind of circles you might be familiar with, is sort of a logic model like this that tends to read right to left. Backwards, I can't make my hand do that. That it starts kind of from inputs, describes your activities. Okay, what outputs are those activities supposed to lead to, and how do those tend towards longer term outcomes? This is a really common one. It's pretty handy when thinking about measurement, because the outputs and outcomes are like explicit things that you have to put in these, or these models tend to feature. So it's a handy way to force yourself quickly to think about measures. Some of the drawbacks of this particular way of laying out your program kind of theory or logic, for me anyway, are that there's a lot of times where the causal link between activity and output and outcomes isn't always well spelled out. And it's sort of like, do X, then a miracle occurs and Y happens, and you're a little bit lost on how the program's going to run, but can be super useful. The next example, this is a real messy example, but this is a driver diagram. These tend to run in the opposite direction, where they have on the left hand the sort of ultimate aim, and they take one step back from that and say, okay, what are the primary drivers that aim? Sometimes they take a step back from that and say, okay, what are the secondary drivers that are driving the primary ones, etc. If folks, these are pretty common in like clinical healthcare quality improvement circles, Institute for Healthcare Improvement, or IHI, uses driver diagrams. Lots of folks may have run across these or have a preference for these. So these are another way to get about this. Oh, I'm sorry, I'm seeing in the chat too, a lot of people have used RBA as a framework, results-based accountability as a framework. That's super similar, just in terms of thinking through what your measures are, what are the drivers of those measures, what's the sort of cycle of, I forgot the exact RBA term, but what's the kind of, there's a specific RBA term about sort of the cycle or the drivers of improvement on the measures that you're interested in. So that's, all of this kind of clumps together. One more example then, yeah, thanks, Demetria, is a theory of change. And these are a little more varied in my experience. Like, they can be visual, as in this example. They can be narrative. Sometimes I've seen like a logic model visual kind of thing with a accompanying paragraph or so that's a theory of change that tends to spell out some of those causal connections. Don't worry about this picture, it's just an example I stole from somewhere, but the difference sometimes in these, sometimes a theory of change can be good for sort of more complex stuff. If you're trying to, if what you're doing is not, we are going to provide service X, people will get benefit Y, and that will lead to our ultimate outcome Z. If it's something more complex, like under these conditions, or if you reach a threshold of X kind of treatment or something, then this outcome will happen in a certain scenario. That's where a theory of change can be more useful. But all of these really are just sticking down on paper in some format the logic of your program in a way that helps you down the road figure out what parts of it you'd like to measure. So next slide. So my sort of best advice on this one as a sort of step one thing is it doesn't matter what you use, like just use something that works, makes sense to you, makes sense to the stakeholders, participants in your program. Think about the time frame. So sometimes a lot of those models, if you're reading it as externally, it's hard to say, what's the time horizon over which this is supposed to take effect? And that's helpful from a measurement perspective because you want to know, well, at what point am I going to be, at what point should I be expecting to see the sort of immediate changes that I'm hoping will happen? At what point should the sort of longer term outcomes show up so that you know when to figure out when to invest in your measurement efforts? And then I guess my other advice just is to keep these as simple as possible, right? Like don't lose the logic, or don't just have some excitingly colored boxes covered, connected by lines. But keep it simple and such that people could take a look at it and say, oh, that's what this agency is trying to get up to. They're doing some work around nutrition and food access and connecting to primary care, and that's they hope will lead to with this group of people, and these are the outcomes that they hope it will lead to. Yeah, keeping it simple is key. I'm going to pause there for a second on that step. Is there any questions, or do folks have other experiences with kind of laying out a little bit of where their initiative logic is going that they can share lessons from for the rest of the group?
Well, I can say, this is helpful as in partly looking at the piece you have here with the, the picture on the left is often what some of my plans end up looking like. So walking through some of it really helpful.
One of the things that we hear often and try to do is a logic model seems so illogical by the time it's about halfway through.
Yeah.
And, if we start off really good and then it's going, then it kind of frays at the end. So that's kind of our feedback. We're not great at it, but.
For me anyway, you hear people talk about logic model as a noun and logic modeling as a verb, and I think the value is largely in the verb side of things. It's the process of putting that stuff on paper and realizing where it's fraying, and realizing that we can get 2/3 of our idea on this on paper, and then the rest kind of falls apart. And that's helpful to know, because that's either the part that kind of needs more thinking in terms of what the program, I'm going to say program for lack of a better word, but what the program design is, or that's the area in which you have the greatest uncertainty about what's going to happen. So maybe that's where you want to focus your measurement. So, it's frustrating and irritating, but it also can be a helpful way to kind of focus attention, I think. All right, in the interest of time, let's jump on if that's okay with folks. And anyway, this will be in the slides that Sumitria has, but just a list of some places you can look for models or, how-to steps for developing various logic model, driver diagram types of things. Okay, so the second step I think is important around measurement that we tend to skip over a lot is just to, this is a quick thing, but just to be clear about who the audiences are for measuring program progress or outcomes and what they want to do with the information. It's really easy, I think, sometimes to just sort of say, we need data, we need to know how we're doing, which is true, but just getting a little bit more specific about the we. Who is the we? What does each person need to know? What do you hope they do when they know how it's going? Do you hope they fund you more? Do you hope they partner more strongly? Do you hope they refer fewer clients your way? Keeping that in mind is helpful for thinking what's going to be most valuable and actionable to measure. And then similarly, thinking about what, if you've sort of mapped out different audiences, what sort of level of data or evidence do they need to take the action that you want them to take? Because not everyone needs the world's fanciest, random assignment control trial to be able to say, well, that program's worth continuing. So the next slide, I think, just has a just an example of different kinds of questions you can answer with data, or in this case, ways to use data for learning. So the case where we're sort of measuring for evaluation is the one that kind of tends to jump to mind, like, is there value in program in this initiative or so on. But there's a lot of other kind of nuances that you can think through. Sometimes you want to measure because you clearly want to know what isn't working with such and such. You have a sense maybe that something, a process or a program is not working well, but it's not quite clear what. Sometimes even just the scoping and describing part of measurement, what are the priorities among a group of people that you would like to engage more heavily in the services you offer, but you don't know why. You don't know now if they have any interest in those or what the barriers might be. Sometimes measurement is way more on this kind of scoping and describing end. So these are examples of kind of questions that people might ask with data, and that these are possibly questions that could be of interest to maybe different audiences that you would have. And the next slide just lays out, I think, this is, the world's most basic table, but I do find filling out something like this quickly helpful, just to say, okay, what are different audiences for measurement around our effort? Funders are obvious ones. Participants in your program or clients or stakeholders in a sort of service recipient role could be there. The partners you work with to offer a program, the staff who run a program for you, all those folks are different audiences and could make different uses of data. So I find sometimes when it's a complex thing or when we're just kicking off, just filling out something, a table like this, it doesn't have to look exactly like this, but to figure out, what are the priority pieces of information that each group's interested in, why, what would they do with that information if they had it, or if they had it more reliably than they do now? What kind of information do they find persuasive or helpful? Like for some people, data is a really broad category of stuff. It includes stories, it includes pictures, it includes, quantifiable numbers, it includes, an evaluative finding that this group ends up with different outcomes than this group. There's a whole range of stuff in there, and having a little bit of a conversation with folks about what kind of information is most compelling for them can be helpful too, in terms of guiding where you put your measurement resources. And the same thing goes with how they sort of, the last column is getting a little bit more into the kind of data communication end of things, but if you know that folks prefer a one pager, if they prefer a bunch of charts, if they prefer a conversation, that can help guide your plans for measuring and then communicating what you've measured. Next slide. Oh, this is, when thinking about audiences for measurement and thinking about communicating, most often we're measuring the programs that we run or the initiatives that we've championed, and we want to communicate how well they've done or what benefits they've offered. Sometimes, particularly like in health, this is a long-standing trope, or in social services too, we all kind of fall into that, a simplistic framing where there's a problem and there's heroes who have battled through it, or victims who are, people who are victims of this terrible thing. And that that happens sometimes. It's a good thing to sort of to keep in mind just how, when you're saying, my program offers such and such a service because, because of this societal condition, just to think about how that's framed, whether people to whom the service is being offered are centered in that narrative, who's concerned, whether it's kind of problems are framed as, let's see, people of color are less likely to get a bank loan versus banks are less likely to offer a loan to people of color. Just kind of some of that framing and messaging, even at the measurement level, can be a good thing to keep in mind for how you sort of infuse equity into your measurement.
Jump in, Lisa, and say, I know where you got that from. And that was,
I know, I was just thinking, I stole that example.
I love that example because the way that you frame this information, when they used this example at the summit last week was it can be the difference between a community receiving charity and people wanting to contribute charity versus looking at what structural change needs to happen to affect, what you're talking about, the problem that you're talking about. Love that.
Yeah, second tip is steal good examples wherever you find them, which is what I just did. And speaking of, there's a couple resources around this. There's plenty of people who work in communications who are much more sophisticated than I am in terms of audience segmentation and thinking about that. But we're not talking about sort of tailored communications today. We're talking about figuring out what's most relevant to measure. So these are just a couple of resources around either figuring out who your evaluation users are, which I think of as audience, and the Tamarack Institute has a nice short piece around hosting a data walk, which is basically a way to share data and get input on this, particularly around interpreting data from a range of stakeholders. So a couple of resources there. Any other sort of thoughts from you all around thinking about audiences for measurement? Okay. So then in my mind, when you figured out you know where your program's going, you've got a sense of what that program logic is, that helps you figure out maybe what your measurement priorities are. You've also thought about who your audiences are and what kind of information they need, excuse me, what formats to take action. At this point, then I think you're at the stage of sort of selecting measures or indicators, and possibly this is extremely pedantic, but just to think about what is a measure or indicator in my, it's not a technical definition, but it's just a piece of data that highlights one thing. It's not a whole story. It's not the whole picture. It's a measure, an indicator. It's specific. It's sort of it doesn't have to be counts. It could be a story. It could be various other things, but it's kind of specific to some who, what, when, where. There's a couple examples of indicators or measures on this slide here. So getting to selecting them, can you go to the next slide? I think there's a couple different ways to go about this. So one way is to kind of start with the story you want to tell, or whether that's a problem statement, or you want to make the case for how your work impacts some other area. And okay, the story I want to tell, or that I think I want to be able to tell, is such and such. What are the measures and indicators that will help me tell that story? That's one way to approach it. Next slide. And if you're thinking along those lines, your program theory of change is a sort of story. So in this example, this is somewhat generic, but if part of your goal is to connect patients, in this case it was with sort of community resources towards their unmet needs, there is a logic model, this is a very simplified one, but for this program, about identifying needs, referring patients to appropriate sources for additional care or referrals, patients actually following up on those and seeking the services if those services are relevant, and then having their needs met. That story, or your program story in this case, or logic model, can help point towards what measures or indicators would be relevant at each stage. So those are listed along the bottom. So if you want to, identifying patient needs, well, how many people were screened? How many unmet needs were there, et cetera, all the way down or over to the right side, about how many folks had identified needs met. You might want to ask how many people are still on a waiting list for those, or how many people were referred but weren't, for whatever reason, able to access the services to which they were referred. You might want to think about, what do people say about the quality of the services, or the usefulness of the services to which they were referred. So that's one way to think about indicators, is coming from your program logic or from your story to a sense of what indicators best illustrate the key points of that. Next slide. This is a different visualization of more or less the same thing. You can think about you know, the process or situation, what's the current situation, what's being done about it, what happens afterwards, that sort of thing. This is very, you know, you could even build a logic model off this little empty table, but just another illustrative way of how you might select measures by focusing on key points or points of change in your program. Another way to go about it is maybe you are an organization that is already sitting on a bunch of data. Well, a lot of folks are, because a lot of folks don't, you know, unless you've recently been born as a group, you might have run a whole bunch of programs in the past. You might have, you are probably collecting a bunch of data mandated by a whole bunch of different other funding sources, and you think, I do not need to reinvent the wheel and invent a whole new measurement schema for this new bit of activity I'm doing. I'd like to make the most of measures I do have. So if you are starting with some, at least sort of a, hey, these are the candidate measures we have in mind. We have some things we think are worth measuring. You might take this route. You've got a bunch of candidates, and then you have to sort of narrow them down, or pick the best ones. And in that case, I think some set of a measure selection process or a set of measure selection criteria are helpful. And I think I've got an example coming up next. So if you're taking sort of the approach where you have some candidate, whether their ideas are fully blown measures, I think what works, or what has worked well anyway, is to identify some sort of criteria around how would you evaluate whether this measure is going to be helpful to you. And those can relate to kind of how feasible something is to measure, how important it is, like is it really easy to measure but no one cares, and what kind of the data quality are. So factors like those that are listed here, like we actually have data for this measure, that's helpful. This measure is, you know, if I were to measure, I don't know, rate of hypertension or something, a rate of high blood pressure among a certain population group that you're interested in. Is that measure available for that specific set of people? Is it available in the geographic area in which you work, or can you only know it at the county level or the state level, and that's not going to help you either sort of tailor your efforts or understand whether your efforts have made an impact? Thinking through whether the measure is sensitive to change, meaning if your efforts do create the change, or if your efforts lead to the kind of change you're hoping for, is the measure sensitive to pick up that change, or would it only pick up something that was a huge difference from the previous year, say? So if you think through some criteria that are important to you, and then you compare the measures you have available against those criteria, and then, you know, depending on how formal this kind of process is, if you, for instance, do it as part of a group, you can sort of say collectively, all right, we want all the measures that we pick that have to meet at least X number, say 4 of the criteria that we've picked. And I'm stealing a lot of this from measure development work that's been done in Oregon. I think that's the next example. So this is primarily coming out of healthcare, but at least a healthcare transformation example. So when Oregon's Medicaid Coordinated Care Organization launched, one of the measures that folks were interested in holding them financially accountable to in some degree was this sort of kindergarten readiness, because there's health aspects. It was seen as a way to sort of push the CCOs slightly outside the health realm and have them think about education and sort of social development of kids as part of what might be under their purview. And there's a whole formal process for assessing whether some candidate measures, in this case it was one around childhood immunization status or physical and mental health assessments for kids in foster care, whether they met measure criteria that this group had identified collectively. So things about whether the measure is evidence-based, whether it's actionable, whether it meets a family priority, which neither one of these did. Anyway, this is just an example of a group formally having outlined what its criteria are for picking measures and then assessing candidate measures against those criteria. Next slide. And in a surprise to absolutely no one on this call, I'm sure it's usually a bit of both, right? So sometimes you're often trying to strike a balance between picking measures that really illustrate the logic of your program or in the story that you're trying to tell, and measures that are actually available and sitting around and feasible for you to measure without investing an inordinate amount of resources in doing that measurement. So you do, in my experience, usually kind of end up trying to muddle your way to at least balanced medium between those two approaches. Next slide, I think might be some resources. There are a couple good resources on this. That NeighborWorks resource on the top has some good, they've got a whole arm of business around success measures, but NeighborWorks works across kind of a bunch of community development related topics, and that evaluation tools are measuring health outcomes in more community development and social service initiatives is a helpful resource. And then I included a few others. That one on the bottom, the Urban Institute one, is a little bit old. I think it's maybe from before 2010 even. So some of the example measures in there are a little bit old, but and I'm not sure that anyone these days would be sort of down with a common outcome framework to measure nonprofit performance. It just seems a little overly broad. But in any case, they do have, that resource has some different examples of potential outcomes that might be relevant in different sectors, you know, like for nutrition and for child and family services and other in other settings. So it could be a good resource to glance at for kind of more topic specific ideas of measures. Yeah, oops. Let's pause there for a second. I think that we haven't done the fourth step yet, but let's pause there too, just to think about or open it up. Folks have other suggestions or prompts around selecting indicators and measures, or building them if that's the case.
I can ask her one. That's sometimes I want to change the world, but then I kind of go, wait a second, I've got to get it short and simple so that I can actually do it.
Yes.
And that's probably where I spend my low vacillation, the pendulum swinging. And I try to go to something I can reach, but then I'm always kind of worried, oh, is it too simplistic? But it never fails that the simplistic always seems to be more difficult than I think it is. But so that's kind of my experience.
How about other folks? I imagine a lot of people have experience also trying to balance between taking measurement that you have to do in one case because it's a funder mandate or something, or because it's sort of a requirement of whatever regulatory authority you're operating under. Does anyone have experience trying to kind of use that measure for a slightly more, for a different purpose than it was originally intended? Nope. Okay. I think I have killed my, sorry, Sumitra, there was a slide that said about step 4, because I promised 4 steps and then we have done 3. The step 4, I apologize, I think I've too many slide versions going. So this 4th slide was literally going to just talk about starting tracking. So you've got a program logic and a sort of clear statement of what your goals are, what your activities are, how they're going to lead you to those goals. You've thought about audiences for measurement, and you've got now, you know, if you're thinking about this process, some measures that you think are going to be a good case. There may be a mix of simple and slightly more complex measures, Ideally, they're a mix of measures, a little bit across your time frame, so that you haven't picked a set of measures that are all a 5-year outcome of your efforts. You have some that might give you an early indication of how things are going, that could help you maybe adjust some strategy in your program, or adjust how you're doing outreach, or I don't know, add some services or something. Maybe you have some, so those are early measures. Maybe you have some sort of middle range measures around, we've got a 6-month, I don't know, nutrition intervention. I want to look, immediately, what does that mean for how people's eating habits have changed, or how people's sort of sense of food insecurity has changed, what else they're able to devote resources to, that kind of thing. You could think around that, about a mid-range set of measures, and maybe you have some measures that are longer term in terms of, other kind of, that might, in your case, it might be sort of a more distal outcome, like, our primary intervention is around food security, but we also hope that with increased food security and better nutrition, there will be fewer emergency room visits. That one's always a stretch. Fewer behavioral related disruptions in the classroom, that kind of thing. So you think about outcomes across your time frame. The fourth step, which I failed to put on a slide apparently, is just to get to tracking. And a couple hints around this one are things that that I've run into. It can be pretty easy once you've got to that stage to go, oh, how good, we decided measures, great, done. Documenting the measures is a huge thing, because inevitably the person, the group who originally decided on the measures in 2 years will have all taken different jobs, and no one can remember what it was we kind of said we'd measure, or how we said we'd measure it. And so just writing down, we're going to measure what, among what group, how are we going to do it? Is that going to be based on administrative data we take, at program intake? Is that going to be a survey that we do periodically with clients who have gone through the program? Is that going to be, are we going to hold a once a year participant sort of convening and get people's stories, that kind of thing? So documenting, that's helpful. And then making sure that there is a person or persons who's clearly assigned to be the person who's measuring that stuff. And maybe it's, depending on maybe it's a range of people, but it's the world's most obvious thing, but making sure that it's actually someone's job to do the measurement. And finally, kind of the third thing is building in some clear points into your, like, whether that's into your staff meetings, or into sort of, if you have a quarterly funder update or anything like that, building in some points for you all to look at the data early on. Because there's been a number of times where you have been involved in kind of initiatives where people pick a totally reasonable measure and it seems great, and it, but the data for it only become available, say, once a year or something, and then you never get around to looking at it. Then it's been 2 years and you think, oh my God, that measure does, when you finally get around to looking at it, oh gosh, that measure doesn't work. For instance, I worked in a reproductive health program where it was, there was an interest in finding out whether people's pregnancies had been intended. And they had a great measurement plan. And then it turned out that the sort of survey that was being used didn't include enough recently pregnant people, basically, to ask whether, about anyone's pregnancy history. Just, it was sort of, the 2 people that were in the survey last year said, yes, when I got pregnant, I intended to get pregnant, but that was never going to be enough data to help them base their program decisions on. So all that just to say is, pick someone who, document your measures, pick someone whose job it is, or whose jobs they are to measure each of those, and build in some time early on to look at the data early, even if it's small numbers, even if you can only look at some of the data, but so that you are understanding early on if the measures that you have picked are going to work out. And because presumably some of the measures you will pick are ones that tell you about, can give you an indication about process improvement or stuff that's happening, stuff that you might be able to intervene about on the early end. That's you want to look at those ones early on as well. So that's my informal get tracking slide.
I was just going to comment that sometimes when you have a multi-partner project, which I think most of these BHT projects are multi-partner, like at least, you know, one social service and one healthcare partner, just trying to make sure you collect the output data can be a lot of work, right? Like, how many times did this intervention occur? How long? So like in one of the projects we're working on around food security, we're just trying to get all the partners right now to just be collecting that accurate output data. And then we're hoping to get to the surveys, right, that can get to more of the outcome data. But I guess sometimes my one piece of advice is don't necessarily start with the outcome. I mean, sometimes you just need to have everybody tracking the outputs, like number of patients served, how long, number of students in the program, how many days after school did they come, just so you can then start to craft appropriate like assessment tools, right? So that's just a side note, but I mean, I know we're talking about outcomes because that's where we want to be, but if you don't even have people tracking household size or something correctly, it ruins your data in the end. So
Yeah, that's a great example. It also helps you really cast your outcomes when you get to measuring them in the right light. Like if you, there's so many, I don't think people do this maybe as much anymore, but there were so many old school evaluations where the middle, all that middle stuff was a real black box. They're like, oh, we have this program, and then here are these outcomes, and no one, without knowing in the middle, oh gosh, all the people we enrolled only lasted 2 months in this program for whatever reason, but no one was tracking how long a program was happening. And so then there was what looked like a terrible and unexplained outcome that could have been solved early on by doing exactly what you said.
yeah, I was just going to say length of intervention or length of time. Like I'm thinking of all the different projects on this call, like the length of time that you spend with a client, or the length, it's important, or the number of times that you deliver food, or it's those are important pieces of the puzzle, and we're just starting to figure that out with some of not related to this program, but after school and summer learning programs. For instance, last summer, we could only do handoffs of kits during the summer. There was no programming due to COVID. So we had these STEM or Lego kits that were given out at food distributions. And then we tracked how many times families came to get the kit. And then, we didn't have a lot of other things to be able to track. We had some social media posts that people could do, so we could track number of posts that families made to social media about their Lego creations, things like that. But it was hard to do any accurate surveying because you had different people coming to different sites to get to get their packets. But at least you could track. So now we've been looking to see, are there any statistical trends amongst the students that participated in, received those packets at least 3 times or at least 2 times. So something to think about for all these projects. Was there more outcome? Was the outcome achieved more frequently if there was more contacts made, with a particular client, and how long and how many? So hopefully there's a data person that can run those. I can't run those types of numbers, but if you have an evaluator as part of your project, they could help look at that data and pull out some trends.
Yeah, I think is there a dose response sort of effect?
Like I'm looking at Kathy, and I know Kathy's doing the food clinic, or having a food bank right at the clinic. And is it just that the person went there one time, right? Or, did they go to the food bank like 3 times in 3 months, and was there a greater impact on their health, right, and their with their well-check visit? Or it's going to be hard because people don't go to necessarily frequently to clinical settings. It depends on, I guess, who you are. I don't go to clinical settings very frequently, but I guess if your target audience is someone who's going a lot, there could be a bigger impact.
Yeah, and I think
Just calling you out, Kathy, because we're both working on food.
No,
Since we're
that's
both
fair.
working on food security projects.
Yeah. It's going to be interesting because that is, I mean, that's the one thing we can measure from Second Harvest perspective. How much food they get, what types of food they get, that kind of thing. And their visits, what we're trying to wrestle with, and the clinic in Providence are helping us through this, just trying to figure out what can we measure on the other end, the impact. We're great at the outputs. We have things in place to count all that, but what we're not as capable at, we just don't have the capacity on our own to measure those deeper impacts. So we're working on that to see what we can do.
And how are you talking with them about the sort of which impacts would you like to measure versus, or which kinds would you like to measure versus what kinds of data are available to measure impacts? How are you guys kind of negotiating that?
Right. It's still, I'd say, in the early stages of that. We have another meeting coming up next week, and that we're all getting together again, because definitely we're not the experts. But originally the idea was for us to provide more medically tailored food boxes for patients with diabetes. That focus. So not totally sure yet if we'll be able to, get any measurements on the effect of the food on their health conditions. But I think that was in the initial discussions. So I think now we're just trying to figure out how that might work. So.
Lisa, do you provide kind of a 101 training? And this is something, Symmetria, we might want to, do you provide like a 101 training on assessment tools, especially creating surveys that are successful at getting to measure, to helping you measure your outcomes? Because that's really been a challenge for us, because, not having a lot of, PhD or master's level people that have, I have some background in assessment tool development, but it's not something I do every day. So that's a challenge, I think, with a lot of organizations, is we know we're going to have to get survey data from people participating in these programs. And how do you frame the questions in a way that will get you the data that you're needing to measure your outcomes? And we've already had to change our screening for kids in this with behavioral health challenges that we're working with Spokane schools to target their families for some, nutrition support. The original screening questions, although I spent 3 months on them with PhD level support, people from WSU Spokane, in the end, kids were not necessarily answering the screening questions. They were, especially middle schoolers were like concerned about saying that they were food and, not answering questions about whether or not there was, they had a fear of not having enough food and worrying about how that might reflect poorly on their family or, child protective services, things like that, So, so we've had to already within 3 months, we've had to totally rework how families are invited into the program and focus on then screening adults after, kids and families are invited into the program. So that's just an example of where, like, we spent so much time trying to create screening questions that were going to be successful in, identifying like a targeted population. And in the end, it it wasn't working. So I don't know, that's a couple different things, but it might be great to have, since so many of us are going to be doing surveys or focus groups to find out if interventions were, what were the outcome of those with those clients. If we could have a training or a support session on how do you craft some of those surveys, those questions, knowing your audience. I mean, they're all going to be different, but.
Yeah, that's a great suggestion. I feel like also this collection of people collectively would probably have some good experience on that. I mean, that what you're saying just sounds super frustrating, but also from an outside perspective is you already know 3 months in that that process wasn't working. You heard from enough kids that answering the questions in the way they were initially phrased on intake is weird and uncomfortable, and they weren't going to disclose that. You are eons ahead of 70 other initiatives that I have run into that no one occurred to ask that, right? Initially.
Well, and we tested the
Yes,
questions
exactly.
with families, and they seemed to work okay. I think the difference was between elementary and middle school, because middle schoolers are a little more savvy about how they might answer. So our the mental health therapist from Spokane Schools, when we weren't getting many referrals, we reached out and said, hey, what's going on? So yeah, it's a constant iteration, right, with partners about, oh, we need to improve this process because it's not working. So
I feel like I'm not gonna put, well, I am. I feel like between Spokane Schools and possibly Pioneer, you guys both, particularly Dave, must have a bunch of assessment experience. Are there things that you guys have found that have worked well for making sure that what you're intending to ask comes across as you're intending to ask it? Or anyone could answer this, but
one tool that we've used to evaluate that's it's a really simple, I think, 8-question questionnaire when we're trying to evaluate well-being, and it's a validated, it's called the WHO index. It's a validated tool for measuring well-being. Questions are really simple. It's only a few of them, but it really gets at a person's own experience of well-being and whether it's improving or not as a result of whatever supports are being provided. So that's very specific to well-being. That's what it's measuring. So it's good for that. But
how did you find that tool, and or how did you go about saying, okay, we need an assessment, but how do we pick a tool? Yeah.
We were lucky enough at the time to have a researcher on staff who'd done a lot of work in public health. And so she was the one that had tracked it down and done the research on it. So we were lucky enough to have that at that time. And she had a lot of experience doing this type of thing. So yeah, so sometimes just having a resource like that can be extremely helpful.
We could also think about putting together a little, sheet of tips about places to go look for validated measurement tools. Sometimes those can be a giant rabbit hole in there. I think, I will know ones that are coming from health and some social services a lot better than, say, I'm not particularly well versed in educational assessment. So, some of you all will know that for your fields a lot better. But we could put together a resource around that, and then essentially a short list of questions to ask about measurement tool X, about, can you, as Amber's saying, when you pre-test it, what happens? Who developed it originally? Who was it if this is a validated measurement tool, for whom is it validated? Is it for just middle school kids in Namibia or something? Or is it for a group of adults who look like the client population you're going to serve, that kind of thing? Any other, just kind of while we're on this topic, are there any other kind of particular areas around measurement or tracking progress that for these BHT funded projects that you all would particularly be interested in further discussion of or help with?
I can tell you, kind of talking what Amber was saying is, you know, when we tested some of the questions, we kind of took it from different perspectives, but when we got it down to some of the kids that come from trauma, it was really interesting, their perspective. And it was very self-protective. It was not trusting the system, but also wanting to take care of their siblings, which was really kind of, it's like, wow, I got to take care of siblings and parents. And we find that we do that sometimes, you know, because we want to help so much that we, you know, have made that mistake. So that's kind of one thing that we, you know, always learn. So we have a meeting coming up this week, don't we, Amber?
Yes, so we decided, we just decided to not do the screening, because basically every family, every child that's in behavioral health therapy could benefit from the support of a community health worker and deliveries of healthy foods. And we can still do the screening of the adult in the household, at least one responsible adult, and kind of measure the impact from the adult's perspective and the intake of food at the household level. So anyway, it's just, you know, multi-generational impact is hard to measure because you're getting into what the parent says versus what the child says. And so ultimately we just want to have a whole family approach and support the family and offer support. And so I think sometimes, again, David, what you were saying earlier, let's just keep it simple. We'll keep it simple and we'll still be able to measure the impact. And and hopefully the families will allow us to, you know, check in with the older children in the household too about, you know, their intake of fresh fruits and vegetables and protein, and we'll be able to get the data that we're hoping to be able to provide back to BHT.
You know, one thing that we found, and you probably all know this, but when we talk about like numbers on free and reduced lunch, we get a really high percentage at some elementary schools, and we take those same kids and we move them up to middle school, and the percentage goes down, and we take that same group up to high school and a percentage goes down because it's not cool to take school lunch. And so it doesn't mean the need's not there, but it kind of, if you put the question and lay over it the developmental and peer responses, in this situation it's food, but in others it's the same thing. And we kind of run into that sometimes when we're trying to do a across the board. We ask a third grader, and then we ask a seventh grader, and then a 10th grader, and it means many different things, and the social pressures to how to answer that and what it means to them. So
Me too. That's an area in which like less, more qualitative measurement can really help. Like if you know, getting stories rather than numbers. All right. How are you all? Do folks need a 5-minute breather? We were going to do some breakouts, but I'm also just wondering how many people are on, and then I think some folks have to drop it too. Is that right?
yeah,
Yeah.
I'm hanging in there.
I'm just thinking, does it make sense to do breakouts, or should we generally have a group discussion if it's only 5 or 6 folks?
Lisa, I was going to suggest, it seems like we're kind of already on the topic of engaging our people. So if we're going to continue the conversation, the breakout question in the main group.
Yeah. Do folks need to stand and stretch for 2 minutes, or would you prefer just to keep running?
I'm good to continue. I don't know who else.
All right, let's jump in. Everyone can stand up and stretch on camera or off, as you prefer. We thought maybe a good discussion question was to sort of think through how, because everyone's in the throes of measurement or thinking about already, is how to involve participants or clients in not only as providers of data in the way that we were kind of just discussing, but also in deciding what makes most sense to measure or to review measures or outcomes as the program's running and decide what might happen, what might need to be done on them. So that's the kind of discussion. How could you involve participants and clients in any of these stages, selecting measures, reviewing, and acting on results? And I wonder if we can start, I know many of BHT's partners have participant or client or patient advisory groups, and I'm wondering if anyone on this call has done this kind of thing before.
That is our intent to do that. That's one of our first steps after we get rolling, but we have not done that yet. But we really plan on working with the clinic pretty closely to make that happen, to get a cohort together for that.
For a sort of advisory group kind of thing?
Yes. Mm-hmm.
And what do you, not to put you on the spot, Kathy, but it sounds interesting. So are you thinking particularly that they might give some input or make some suggestions about what would be relevant to keep track of through the program?
That's a good point. Again, I'm not really sure how that will look, but I think we feel like bringing the folks most affected, our target audience, essentially, our target client audience to the table, just to get their perspectives, learn more about what's impacting them. That will help lift up, some top priorities of things to measure. So even if they don't know specifically what those items are, maybe through those discussions, we can learn more.
Mm-hmm. That sounds fantastic. How about other folks? Anyone else involved sort of program participants in kind of decisions about what makes most sense to measure or track?
So Lisa, this is Cameron with SNAP, and I'm going to talk about a project that isn't specifically related to what we are doing here, but we were doing some work out at a specific apartment complex, and we actually took all the information and the design of the program of what we thought it would be to an open house, basically, kind of like an open house forum, and had people come through, and we had incentives and all kinds of other things. And we had different tables of, what are the barriers, what are the needs, what are what would you see would be the goals or the outcomes of this type of program. And that helped us design what we were going to measure then and the tool that we were going to use. So, and we had, it was, of course, we offered food and all kinds of other things so that people could come in. So we had a significant enough people coming through that were going to be using the program to help us design that program.
That sounds fantastic. Were you surprised at what you heard? Assuming you guys had some at least ideas in the back of your mind, and
was able to kind of like, oh, so that won't work. Oh, I understand. Yeah. So we were thinking we would come out, twice a week, and they were like thinking that there were we had kind of gone on the assumption that most people were not working, and yet there were a majority of the people were working, so we had to readapt the hours and that kind of thing, just in program design. But again, the outcomes of the program, I think, helped us. They helped us understand what really works as a tool there, rather than a survey tool. We needed to come back out and do something similar to what we had just done with the open house. Was,
Mm-hmm.
yep, to get the information.
Mm-hmm.
Yep.
Yeah, I feel like that sort of connects back to the sort of a more qualitative approach sometimes
Right.
is going to get you better in the end. In the end, it might be better information, even if it's potentially from a smaller group of people. That sounds also very like the data. I can't remember if this resource was called a data party or data walk, I think, Tamara, but one of the resources I put earlier about a data walk sounds very similar to what you guys did. It's the same kind of idea where you can have different stations that might be in that resource. It's focused on sharing results of some measurement, but where you
Okay.
kind of have different, you have different measures, a data point kind of at a couple different stations or tables or slides or breakout groups, however you do it, and have some questions for people to react to about that data point, but you don't try and wrap it all up into one discussion, and people circulate through,
Oh.
7 minutes or something at each station. But it sounds it's a real similar approach that you guys seem like you've had some practice with, so maybe it could work well when you have information to share back.
Yeah.
How about other groups? Has anyone worked with program participants to, I'm going to say collect data, but could be collect stories or whatever, but essentially as your measurement partners? For instance, if you had like a navigation initiative where you have community health workers who are working with clients to assess needs and refer them on to various services. Have you done anything where, for instance, you have, I don't know, every 5th or 50th client talk to one other client about their impression? I've seen some, not in confidential services, obviously, but I've seen some programs who work with participants as data collectors, kind of, perhaps this works well like in peer programs too. Has anyone done any of that? How about, has anyone had experience with collecting data in the form of videos or photos or little voice narratives, particularly around program, or I've seen it often with relate to like either assessing needs or around program experience? Has that been something that folks have worked with at all?
I have not, but I would be very interested in that. My project right now that I'm working on for SNAP is a community needs assessment, and I think that's an interesting idea.
Mm-hmm. There are some, I can look into some resource around it. There's some really interesting photo voice or video or photo language kinds of techniques, and sometimes that is talking a lot more about the analytic approach of how you look at visual data, but there's some also really nice kind of just participatory techniques where you have folks, I've seen, and I feel like I run into this with youth a lot, so folks who've worked with youth might know more than me, but where in the days where it was easier to be out in the community, you give folks disposable cameras and you collect images, and you give, if you're doing, for instance, a community needs assessment, if you kind of give people a couple focused prompts, take pictures of what you think how people are feeling about issue X in your community. And it could be, and you get pictures across a range of things, they're tiny close-ups of leaves, or they're big landscapes, or they're people doing activities. And then you ask people to sort of talk through what, why that picture, what does it mean to you? How does it connect to the issue, the theme, or the need that you're investigating, and how people, both the image and then how people explain the image, become part of your data and part of your understanding of whatever it is, the need that's being under investigation in your case.
Great, Lisa. That I love that. and it kind of triggered another thought about maybe taking photos to like a community forum or doing,
Yep.
and then having them speak to it, to a photo.
Mm-hmm.
Yep.
Any other, I don't know, without knowing which name connects to which agency, I'm not entirely sure, but anyone else work, like, Christine, do you guys do any kind of data collection with Recovery Cafe participants, or whether it's informal or not, have like storytelling at all? No. Any other thoughts folks have? Like, how do you do, how have you all involved clients, whether, putting aside data for now, in general, in program design, it sounds like advisory groups are fairly common. Are there any other ways that folks have involved participants, whether they're current or future ones, in giving the agency or a program some direction?
We have done surveys. We've
Yep.
asked for feedback. We've asked for involvement on a project we're still trying to finish up with BH2 and getting the contract. Is we want the kids to come up with a name for the program, so involving them on that. So those are things we have done, kind of not, they're pretty informal, but they work. So, and Lisa, I'm going to need to take off, so I just want to say thank you for all you're doing, and I apologize for leaving a little bit early.
Oh, just good to see you.
All right, take care.
Yeah, you'll take care.
Bye-bye.
Well, maybe, unless anyone's got any other sort of particular ideas on this kind of breakout discussion, maybe that's a good point to kind of step back and start towards closing up. Does anyone else have anything to add or ask around this topic?
Do you have any, because we do collect a lot of stories. I mean, that's kind of our big, that's something we can do, talk to people about the impact of the food they receive, food assistance, just kind of that one-on-one type thing. In terms of, using that for reporting and such, I mean, we often share the stories, but do you have any other recommendations on how to best use that? I mean, yeah, it's nothing you can really count, if that makes sense. I'm not probably explaining it very well, but.
No, I think you're. I do have I have a couple of thoughts. I don't know if they're at the level of recommendations, but there are, there's a whole discipline around qualitative data analysis that you can, that you can do either a very kind of ground up thematic interview, coding of stories. You can do that. That's resource intensive and it's best done by someone who's got a little bit of experience in that, although it's an awesome project to farm out to like the qualitative methods class at the local university, or it feels like there are always PhD students and master students always need data for their projects. So I think those guys are can be a good resource for that. I don't know this as well, but I feel like I've seen recently, and I will try to find some resources on this. I've seen folks do story banking as sort of an approach where it's not a whole analysis from a qualitative perspective, but there is a little bit of and maybe you do this already, where there's a format that stories are stored in and collected in so that they can be extracted for, whether it's a blurb in your annual report, or whether maybe there's some very light coding so that, like that we record all these stories and we have a menu of 10 topics that these are about, and we say, okay, this one is touching on topic A, B, and C, just so that you can pull them pull them when you need them, but also if you start seeing over time that, wow, all of our stories really lean towards, I don't know, injustice or something as a topic, that's a piece of very informal analysis that you can do of your narrative data. Do you guys have kind of a structured format that as you collect stories that they're stored in?
Sure, we do. Yeah, just actually only for the last couple of years, we've had a story bank. We use
Okay.
a Airtable base to store all that. We've stored them in different ways, but this is definitely the best, where things are more connected. And we haven't really done any coding. We do put them, we have what we consider our 5 initiatives: feeding kids, feeding families, feeding seniors, and rural hunger. So we have them categorized by that, but
Yep.
it's about the extent of that. But yeah, so we should learn more about what more we could do with the coding, or get some students involved in that. That could be interesting. So
Yeah, but let me see. I'll I've been keeping track of some of these requests, so let me see if I can find any good sort of resources, either for kind of getting started with qualitative coding without making it your life's work, and if there's anything around some of the more, actually the narrative change piece that Sumitra was mentioning earlier.
sure.
I don't know if there's any good tools sitting around on that would be good.
Great, thank you.
Lisa, we would be interested in that as well. We just have a brand new client management system, and we're using Salesforce, and there's a feature in that. And again, we can attach the story to the client case, and then pull it. But I don't know that we've done any in-depth research on the coding part of that.
Okay.
Yeah.
That's really handy if Salesforce does that, because then presumably you can pull by all the other data that you do have in Salesforce and whether or not there's a story
Yes.
collected. So yeah, that's interesting. That's smart of Salesforce. All right. Okay. I think I just had Sumitra, I don't know if you want to go to the next slide. I think I had some very high level general advice, which I think you all are on already, which is just when you're thinking about outcomes and measurement, just to, make your life sane and keep it small and manageable. There's so much there's so much out there in terms of potential data, but starting with kind of effectively organizing and using the data you do have, I think is just a general good piece of advice. And we've touched on a lot of this too. We're touching on it right now, but data can be a broader category of things than it doesn't have to just to be counts and so on. And actually, Cameron, your Salesforce example is a really good one. I was going to sort of put a plug in for, if you're building something, if you are going to say, you know what, we do need to do a survey and there isn't one that already exists, so we're going to build our own measure, or we do want to collect stories, and we haven't done that before, and we're gonna put some effort into building a process for that, to not build that stuff in a silo. So for instance, in the Salesforce example, if your stories are connected to other data you have for client, I mean, that gives you so much more ability to either pull ones that you want to meet a specific purpose, or use the data you have about the range of clients, the range of programs they've been involved with, their demographics and so on, to say, hey, are we getting any stories from our African American clients, or do we not have any of those? And wow, should we think about another way to collect them, for instance? So that's my kind of quick general advice. And I think I also have a final slide, which is some other kind of resources that weren't connected necessarily to any one of those 4 steps that I went through, but there's some around equitable data practice. There's a recent, at the 3rd row in there is a health affairs blog that I don't think will surprise any of you, but it's someone making the case once again for addressing social determinants of health in healthcare, but it's got a section around what this set of authors thinks people ought to pay attention to in terms of measurement that could be interesting. And the last thing is a blog that Core has that is more or less the 4 steps that I just went through. So I'm just linking that in there in case folks want to check it out.